So, looking at the next, motor neuron issue, we look at what is known as an ascending paralysis. Ascending paralysis. So, for this ascending paralysis, just like the name implies, it's a very simple thing that you could actually understand. So, ascending paralysis just simply have to do with. Can I say this? So, it's a pattern of muscle weakness. So it starts in the lower limb and it's coming up to the body. Alright? So there's a progressive damage. You understand the whole thing? So, so it's most famously associated with Guillain-Barré Syndrome. Now, Guillain-Barré Syndrome, the myelin sheet of your nerves is kind of like wearing off. So key features: it begins in the legs and feet. It spreads up. From the lower limb is coming up, potentially to come and affect the respiratory muscles, which is one of the reasons why a patient dies of. You understand? So it's often accompanied by numbness and tingling and loss of reflexes. Can progress rapidly. Okay, sometimes within hours and days, the patient is already down. You get. So moving to the next, common causes include things like Guillain-Barré syndrome, tick paralysis, botulism, acute transverse myelitis. Okay, so diagnosis is just lumbar puncture. You just want to evaluate the cerebrospinal fluid, all right, to see if there's proteins is elevated. Of course, I think that one you now start suspecting that maybe there's a neuron issue like Guillain-Barré syndrome. Then, so treatments include intravenous immunoglobulin, plasmapheresis. Okay, and supportive care, like if it is affecting the respiratory system, you basically help the person on oxygen so that they can keep breathing well. Okay, so that's it for ascending paralysis.